if you just tuned in, I'm Dr. Mandell. We have Dr. Mendelsohn. Dr. Mendelsohn is part of the family. We have many different doctors and medical on the other side of the family. And she is a pharmacist, a doctor of pharmacy, of pharmacology, you could pretty much say, when it comes down to she's the one that deals with medicine, from high blood pressure to pain medicine to autoimmune problems. Give us a little input about your background, what you deal with every day. And the purpose of this program is to help the millions of people worldwide, to let them understand the basis of painkillers, what they're buying over the counter, particularly to our Advil, our Motrin, our Tylenol, our Aleve, our Aspirin, and we'll touch on all those kind of things. We'll touch on the side effects. We'll touch on those particular medications that can perform better for certain situations than others. And I'm sure we're going to have a lot of stuff we're going to dig into, because I have some questions to ask you as well. And we will then go for some Q&As in just a few with our chat, as our chat is building and as notifications are being out, because we are live streaming. I'm going to give it to you a little bit about your background, what you deal with, and maybe a little bit of just whatever you like to say from the heart right now.
Sure. So I'm a retail pharmacist. I deal with a lot of different issues, a lot of different medications, dealing with doctors' offices, insurance companies, customers. But something that's very important in my job is over-the-counter medications. People have a lot of questions about them. I deal with questions every 5 minutes. I basically get someone that walks up and says, I have this pain, I have this cold, I have this fever, I want to try this new vitamin, please help me. So I'm in the aisles a lot dealing with that topic, over-the-counter medication. So when you asked me to do something about Tylenol, Advil, Aleve, Aspirin, I got really excited because this is what I do on a daily basis.
All day long. So people routinely come up and ask for the pharmacist and say, can you tell me this? Can you show me this? Can you tell me what's best for my condition? And obviously, you're going to really see more than the average doctor when it comes to people with medicine, because these people they're looking to get something on their own without a prescription. Right. And obviously, these types of medications are offered in the drugstore, like you said. Okay, go ahead.
Right. And I mean, like you said, they want to get something now. They don't necessarily want to take the time to sometimes go to the doctor, which sometimes I can help, sometimes I can't. But yeah, so just basically every day I help people with, common problems. I sprained my ankle, I hurt my knee, I'm having back problems, I have a cold, I have congestion, I have a runny nose, I'm having allergies today. I'm just helping them with basic everyday needs that everyone has.
I like let's start off on a couple of these particular over-the-counter medications. This is something that so many people really need to understand. And it's so important that these people really understand the foundation of a pain, which is obviously most people have some pain. And generally when there's pain, there's generally inflammation. Mm-hmm. And so when we look at inflammation, they want to make sure, or you want to at least give them the knowledge of what that medication is going to do versus an acetaminophen and an ibuprofen or Naproxen. So let's first start out a little bit talking about what are non-steroidal anti-inflammatories versus steroids or something else. Maybe you could give a little understanding, because these medications are mostly non-steroidal anti-inflammatories that they're getting over the counter. Is that correct?
Right. Yes, definitely. So known as NSAIDs, it's easier to say. You have your ibuprofen, your aspirin, and your Aleve. And so what this helps is it helps fever, it helps pain, but it also helps inflammation. So on the other end, you have your Tylenol or acetaminophen, which is also very popular, as popular as ibuprofen, I would say. But that actually doesn't help in inflammation. So a lot of people don't really know that. And they say, they come to the pharmacy and they say, man, I really hurt my ankle. My neighbor told me to get this. They show me the Tylenol. And I say, actually, you have a lot of swelling. That's not really going to help.
And that's really important. So a person has inflammation. They have a neck problem, a joint problem, a low back problem, a sacroiliac problem, a knee problem, an ankle problem, inflammation. I noticed many of my patients over the years would say, I took some Tylenol and, I felt a little better. But the difference is that the Tylenol, which is acetaminophen, has no anti-inflammatory effects.
Right.
But generally, the acetaminophen generally is for headaches. For pain or for fever, correct? Primarily.
Correct. Yes.
Oh, then we so we're looking at the Advil and the Motrin. They're both ibuprofen. Okay, so regardless of the name, sometimes people get very confused. Like one's going to do any different than the other. It's the exact same medication as ibuprofen.
It's very confusing. It is exactly the same. No difference whatsoever.
And I think that's a very important thing the audience should really understand is that they're not clear what they're taking, but it's the exact same type of drug because it is ibuprofen. Now, we look at the Naproxen, which is our Aleve. Our Aleve still is considered a non-steroidal anti-inflammatory drug. But obviously, the difference from what I know, and you can move on this, is that the duration of how long, the half-life, how long it stays in your system is longer than obviously the Motrin or the Advil. And maybe you can comment on that.
Yeah, so you can take Aleve every 8 to 12 hours. So some people do prefer that because you don't have to ibuprofen is every 4 to 6 hours. Some people don't want to have to take a pill every 4 to 6 hours. So Aleve is better in that sense.
And the aspirin, the downside of aspirin is bleeding, obviously for someone who may be on blood thinners, or obviously more inflammatory changes in the gut, the stomach if someone has an ulcer. So basically someone has stomach issues. The first thing I would assume is when they're taking any of these medications, always better with food in your stomach. Maybe I'll comment on that. Correct.
Definitely with food, or if they're very nauseous and can't take food, you can do a cup of milk. That does the same thing as food. That's the biggest thing in my job that I try to do is that when someone wants ibuprofen or Motrin, I don't have that much time with them, but I try to get their background of, do you have any stomach issues? Do you have any blood pressure issues? Because that's really important when taking these.
Denise Doctor here says, Aleve with high blood pressure. We know that ibuprofen can, I guess, any of the non-steroidal anti-inflammatories could raise your blood pressure. Is that right?
Correct. They all can increase your blood pressure, all the NSAIDs.
All the NSAIDs. So regardless of what NSAID it is, it has a possibility of increasing it. Not that it will in every person, but it can.
Correct. It can.
Okay, got you. So if someone comes in with high blood pressure and they want to take, that's a decision that they have to make because obviously you're not there you don't know their underlying history and you're not there to diagnose them. So you have to they have to understand that, well, if I'm going to take this, maybe I want to monitor my blood pressure.
Correct. And it depends how controlled they are. Some people have high blood pressure that are well controlled on their medications. Some people aren't well controlled. So it really depends on how your blood pressure is that day.
That's correct. And so what about ibuprofen with the kidneys? Now, from my knowledge, a little bit of anything is not going to kill you. But if someone is doing something for prolonged periods of time, that's when I guess someone has to really wake up and get serious.
Right. Right. And that's why they don't want you to take any over-the-counter medication for a long period of time without seeing your doctor. But definitely, if you have any type of kidney disease or any type of problems excreting things from your kidneys, you should stay far away from any type of NSAID.
Very, very important. Here we have Rick Thomas says the best medicine for neuropathy type of pain. Well, for those who do not know what neuropathy is an inflammation of the nerve, and basically it can travel into the extremities, upper or lower. But we're looking at neuropathy, inflammation. So if this person decides to take Tylenol, which is acetaminophen, it's not going to really do much for the underlying causation of the problem, but maybe for the symptomatic point of view, of getting out of pain maybe.
Right, exactly. It's not going to work as well as some of your other medications would.
Yeah, if you just tuned in with us, I'm Dr. Mandell. I have Dr. Mendelsohn, she is a pharmacist. And she is the person that knows more than anything about medicine, much more than your doctors. I promise you, with these doctors, and listen, I have a lot of medical doctors and they're great, but the amount of time that a pharmacist spends when it comes to going to school, what does this say? I prefer harsh, yes, we'll go into that. When it comes to my hours they spend going to school, it is a lot of hours. And there's so much to know because they have to know biochemistry, they have to know interactions, they have to know, obviously, the physiology of the body because pharmacists are a key player when it comes down to you feeling well, not only in pain, which we're touching on today because that's our topic, but I'm sure we're going to get many other comments. And we will take your comments as they come in. Here is a comment right here from Surya. Hi, after too many antibiotics, about for 30 days, mind and thinking changed like OCD and negative thoughts started And from 2 years, I am suffering, but better than last year. And now I come out this completely. I don't really understand exactly what she's saying here, but let's talk about this for a second. Antibiotics, what type of interactions should they be aware of when we're on antibiotics with pain meds? Is there any particular interactions? Because we do know that certain drugs, obviously, or certain foods, even vitamins or nutrients, can affect the assimilation of medicine.
Right, right. What's good is that there's not a lot of interactions with antibiotics and pain medications. You'll see a lot of people prescribed antibiotics with pain medications after surgery, after a dental procedure. So the good thing is with that, in that sense, it's okay to take pain medicine with antibiotics. That's fine.
Brian Lloyd says Gabapentin Safe with Tylenol. Gabapentin, they primarily use this for conditions with the brain. With
neuropathy. A lot of times people are on it for neuropathy pain.
So mixing. Let me back up 1 second. I know that from the last that I've learned that they state that you can mix ibuprofen with Tylenol at certain points, I guess, depending upon. I know you can do that, but they say not to mix ibuprofen with ibuprofen.
Correct.
Did I say that right?
Right. You don't want to take Aleve and Advil together because your kidneys are going to be shot. But I don't recommend necessarily taking them together. You can, yes. Yeah. But I recommend staggering them. So if you took a Tylenol at 8 a.m. and at 11 a.m. you're still in a lot of pain, you can take an ibuprofen. So I recommend staggering them so then your pain is covered.
That's good. So gabapentin, is there any effect with Tylenol, acetaminophen, anything we should know with gabapentin that you know of?
No, nothing on the top of my head. The only thing I recommend is if your gabapentin is not working enough for your neuropathy, definitely speak to your doctor. Maybe you have to increase the dose. If it's just something like you have a headache and you want to take Tylenol, then that's fine. Gotcha.
If you just tuned in, Dr. Mendelsohn is my guest. We have the delight. We are delighted to have her here. She's going to be a big help, answer a lot of questions. Wherever you're tuning in, you can actually tell us where you're tuning in outside the United States. We're very curious, maybe out in Africa, way out in Europe. We'd like to hear it. You can actually ask your questions as well. We will go ahead and bring you on as much as we can during this. What is the over-the-counter for opioid overdose? Is there anything we should know about that? It's a little out of our league here, but if you could answer that.
Yeah, so what you get is you have to get it in the pharmacy. So you can go to the pharmacy and you don't need a prescription. You used to need a prescription for the naloxone, and you can get it now without a prescription. You just go to the pharmacy. You say that you know someone on opioids, or you're worried or whatnot. It could be for yourself, and you just say that you want it.
Interesting.
Yeah.
Irritable bowel syndrome. Even though we're a little bit off our topic here, very common thing. The reason why I think that's a good question is because those that are taking pain meds, or let's say ibuprofen, again, we're talking about gastric, intestinal, it can inflame irritable bowel syndrome. So I gather, we don't want to make diagnoses for anybody out there or tell them exactly what they should or shouldn't do, because we're not your doctors. We're just trying to guide them. But anything that has an inflammatory, a gastrointestinal response, I guess they have to be careful. I would assume.
Yeah, I would definitely, if I had irritable bowel syndrome, personally, I would try to stay away from any type of NSAID. I would lean more towards Tylenol just because I wouldn't want to flare anything up.
Yeah, makes sense. We want to say hi from Sydney, Australia. Beautiful. We'd like to know where you're from as well. Here's a question here. Any side effects from too much of a painkiller? Absolutely. Anything you take too much,
of course.
It's like any other thing. Definitely side effects. I mean, that's just something I think you need to be aware of. A lot of people will think, hey, listen, I'm taking a medication, regardless of what medication, I don't feel it really doing anything. So I'm sure you heard people say, I want to take more. And that can be a very dangerous thing.
It's very dangerous. And I do see that a lot. Painkillers, nausea, vomiting, obviously upset stomach. Most people are going to have that drowsiness. I don't recommend, driving after you take painkillers. And also something where if say you had a surgery or something and you just got prescribed a painkiller, a lot of people don't know that Tylenol a lot of the times is within that painkiller. So some people will take the painkiller that their doctor prescribed for them and take Tylenol over the counter and really can risk getting liver disease.
I want to say hello to this young person here. watching from Iceland. Boy, I haven't had an Iceland here a long time. Wow. God bless you. Thank you for being here. And thank you, Canada, for being here. Toronto, Canada. Natural painkillers. I want to just mention a few of these, but I'm going to mention more of anti-inflammatories. I think it's important. I'm going to make a comment here. And we want to say hello, by the way, to Yvonne here from South Africa. Pretty cool. Hello, Brazil. We want to say hello to you. And good old Boston. Okay. I'll touch on that 1 second. Qatar. We hear about those planes out there, right? Lots of good stuff out there. New Zealand. Hello there, my friends. But I want to mention briefly about some natural great anti-inflammatories. The cayenne pepper, the capsaicin is excellent. You have boswellia, omega-3s. I've reading some interesting studies about omega-3s, how it actually have done studies compared to the old ibuprofen, and omega-3s have done wonderful. And it's very, very safe, very good for the heart, very good for the brain, very good for the cells. Ginger is great. Cinnamon, the gingerol, the cinnamon, the cinnamaldehyde, the garlic. Black pepper has great anti-inflammatory effects, as well as green tea. We have the catechins in green tea, which are exceptionally good, very safe, and it actually there's a lot of great benefits for you as well. I want to say hello to, we had it right here. You disappeared from me, huh? Okay. Here's a question is saying, is Advil, is it good? Is it good for what? I mean, just maybe a comment you want to make to this listener here.
So, I mean, yeah, Advil's great. It does wonders for a lot of people. The only thing that you just have to be concerned of with Advil or with any over-the-counter medication is make sure you take it within limits. Don't overtake it. Make sure you also see, if you've been taking it for 2 weeks, say, I've been taking this medication for 2 weeks. Let me see what the underlying problem is, which a lot of people don't want to take the time to do. They just want to keep masking the symptoms. If it's, you're taking it from every now and then to help you with a common headache, or you had an injury and you strained something, then it's great.
Doc, what is this? Is it safe to take irbesartan? Irbesartan, did I say that right?
Yeah, that's a blood pressure medicine. Yeah, that's fine. You can take it on an empty stomach.
Okay, wow, this is great.
Mm-hmm.
Love your banana cinnamon cardamom tea. Oh, wow. Thank you. That's nice. I hope it's helping you. We're going to get a lot of interesting comments. And again, if you're out of the country, let me know where you're coming from. Here is someone from Pakistan. We're going to say hello to you, Azar. Wow, just to tell you how beautiful you are. Hello, Montreal. And if you want to pull little slots, we can go to Vegas right here, right? Naproxen. What would you like to know about Naproxen? Naproxen is obviously is your Aleve, correct?
Mm-hmm. Yes, that's Aleve.
Still a non-steroidal anti-inflammatory. The difference here, as we say, has a longer half-life, stays in the system long. You don't have to take it as often.
Right.
I personally have found for myself is that Naproxen seems to work better on me with chronic ailments. It seems to just work better. Maybe, I don't know, it could be in my mind. I've used some ibuprofen, but I guess ibuprofen works differently in each different chemistries. I mean, every person is different, correct?
Exactly. Everyone is different. It's everyone's personal preference. So, I mean, some people, they get very overwhelmed. They don't know what to take. So I'll just recommend one thing because they just don't want to make the decision for themselves. But it's everyone's personal preference.
We want to say hello to Sandy Linder. Love, love, love this. Well, Sandy Linder, we love, love, love you. How about that one? Okay. Hello from Albania. Did I say that right? There's a lot of Al's. I guess we have something in common. My first name's Alan. So we will go ahead and take your questions as we are moving along here. We're having a lot of fun. We have Dr. Mendelsohn joining me as a special guest. She is a she's a pharmacist, and she is here helping us talk about the painkillers. And we did a little quick review, the difference in Advil, Motrin, Tylenol, Aleve, what they're all about, Aspirin. They're all non-steroidal anti-inflammatories. These are the things you get over the counter, but we can say that in general, the ibuprofens are more or less more derived to affect the kidney, as the acetaminophen is more to affect the liver. So
Right.
Therefore, we're saying to people that if you are taking too much of something, this can obviously cause a problem. Sawadis in Thailand to Panata Grano, all the way from Thailand. Sawadi Shalok. We thank you so much for being here with us. We say hello to you in Jamaica as well, and that's a beautiful thing. Hello, South Carolina. We will grant you respect in the United States here and in India as well. And again, we will take your questions. We're talking about pain medications. We have Dr. Mendelsohn helping us. And let me tell you, I love it because I'm learning myself. Doc, here's a little something off here. I thought maybe we'd give her a little respect. We have a class 3 severe congestive heart failure, postpartum cardiomyopathy. Can I drink colloidal silver? I will tell you this. That's a question probably not inside either one of our rounds because we are not cardiologists. Colloidal silver, I can tell you, is pretty safe in essence that if I use it in my eyes, I use it in my throat, I use it for a lot of other things. And again, it is over the counter, and I really don't foresee any issue if you use it in moderation. But if you have any type of underlying pathology, disease, condition, I always recommend to speak to your physician, always. And I'm sure Dr. Mendelsohn would tell you or any other patient of hers that walks in her and walks to her and asks her, well, I have this, can I do this, can I do that? She can tell you, what the drug can do, but again, she doesn't know your underlying history, she doesn't know your lab work, she don't know anything about your condition, she don't know about anything about who in the family has what. So I think it's a very fair statement to always check with your doctor. Does NSAIDs react with ACE inhibitors? Jojo Falero.
No, you can take an ACE inhibitor with an NSAID. That's perfectly okay.
Interesting. See, I didn't know that. We're talking about red yeast rice. My thoughts, and she can have her thoughts. I think the thoughts are pretty good. My thoughts are pretty good because of the fact that there's been a lot of stuff on the shelves, a lot of political stuff on this. A lot of this stuff comes from China. They're using this right now overseas in Asia. Red yeast rice primarily is those people who are taking the statin drugs, those that want to kind of substitute statin drugs. What's your opinion on the red yeast rice? I'm sure in the pharmacies, they do sell the red yeast rice.
Yes, they do have them over the counter. I do have a lot of people that either take it with their statin or they can't take a statin from the side effects. So they take this along with fish oil. I see it happen a lot where they just can't tolerate the statin. Whether it works or not, that's debatable. Some studies have shown positive effects on your cholesterol and some studies haven't really shown much.
Interesting. West Virginia, East Virginia. Brian, hello there, Brian. Here's a beautiful lady. She's saying, please like and share this video. That's very nice. I really do appreciate it. If you have not subscribed, please do so. Why? Because we put out videos almost every day for you. And if we're not putting out videos every day, we're having videos like these almost as much as we can. We're going to bring on lots of professionals. And I know that Dr. Mendelsohn is going to love this because this is going to replay. And I'm sure many people who are listening to this later on are going to love this. They're going to learn a whole lot of great information. We have someone here from Australia, Melbourne, Australia. Her partner has fibromyalgia, psoriatic arthritis. Her use of oxytocin has increased in the past few years from about 10 milligrams per week for breakthrough pain, but now she is on 10 to 20 per day. She wants to get off. How can she control the pain otherwise? Now, obviously, Dr. Mendelsohn is not going to diagnose or tell you exactly what you should or should not do, but she can give you maybe an opinion of something maybe you can add or something you can do naturally to help you get off the pain. From one condition to another, the psoriatic arthritis needs to be followed up with your primary physician. I think that's a fair statement.
Right. She's probably on not oxytocin. She's probably on Oxycontin for her pain.
I'm sorry. Yes, Oxycontin. It's definitely not Oxycontin.
Yeah. So she's probably in some severe pain. She probably sees a pain management doctor or neurologist or something like that to manage her pain. So if she really wants to get off of it, they'll probably slowly decrease it and try other medications. I mean, there's so many different pain medications out there to try. It's just hard to wean off. So it's definitely something that they'll have to do slowly.
Meet Char's Budget World. Can you explain the difference between ibuprofen, Duexis, and regular ibuprofen? I don't know that answer.
So Duexis also has something called a proton pump inhibitor in it. So it has the omeprazole with the ibuprofen. So some people that have stomach issues will take this instead because it also has something that will coat your stomach and not hurt it. The only problem is it's very expensive. If it's not covered by your insurance, it's very expensive. Honestly, it's the same exact thing as taking omeprazole or Prilosec or pantoprazole, any of those with ibuprofen.
While we're on that topic, I think a great thing to go into are the proton pump inhibitors. I think many people out there, particularly many of my subscribers, I put a lot of great elixirs out there, for weight loss and other things. But we find that a lot of people listening right now have gastric problems, and that can come from many different things, from poor diet to just drinking too much with your food, diluting the enzymes, to not enough fiber, to side effects from medications.
Right.
When we look at a person who may have acid reflux or GERD, and primarily the first thing they want to do is they want to get rid of the pain, but obviously you have to get to the root of the issue. The problem with proton pump inhibitors that I have found from my experience, you can comment on this after, is that proton pump inhibitors kind of shuts off the acid in the stomach. That's the whole idea. And from that perspective, without acid, we cannot assimilate calcium into the bone because calcium needs acid. And protein is not digested completely if you don't have acid. So there becomes a whole reoccurring situation that can occur, from one drug. What is your opinion on proton pump inhibitors in the sense versus your Zantac or your Tagamet, your acid blockers versus proton pump inhibitors?
I think if you need it, they can be very helpful. Proton pump inhibitors last longer. They actually took Zantac off the market, so ranitidine is no longer even on the market. Yeah, so they're having a whole bunch of issues with those. I understand if you need it and if you're in daily pain, then you take the medication because you don't want to be hunched over all day. I think a lot of problems with proton pump inhibitors, though, is once someone starts it, they never get off. They're just on it. No one wants to touch it. No one wants to bother with it. They just stay on it for the rest of their life.
Yeah, and one thing I will state, because I was on them, and the reason why it's hard to get off, and I'll explain my experience. Make a long story short, the body, once you stop, it's kind of like someone who's a chain smoker. You go through withdrawals. And those 4 or 5 or 6 or 7 days, you may get a lot of discomfort in there. So right away they get the discomfort, they start back again. But sometimes you got to pass that 4 or 5 day period to get through it. There's a lot of things that can be done when it comes to proton pump inhibitors, which I'm not going to go into this program. We'll talk about another time. But I just wanted you to have an understanding that this is much stronger than the basic acid blocker. All right, because obviously one is shutting it off, and an acid blocker is obviously something that you're just temporarily shutting it off. Let me just, am I right? Just short, more consideration.
Yeah.
Okay. If you just tuned in, Dr. Mandell here with Dr. Mendelsohn. She is the doctor of pharmacy. She's a help me on that one. A pharmacist.
I'm not a pharmacologist.
It got stuck in the back of my mind. Here's a question for you, a little bit off. Take metformin. Those people take metformin, obviously, is for people who are type 2 diabetes. She takes it twice daily. Is it safe or just quit taking it? I mean, I'm sure you hear this all the time.
Yeah, so metformin can cause a lot of stomach issues, a lot of GI problems. So a lot of people just don't like it, but the problem is they need it. So if your doctor says, you know what, your sugars are doing great, your A1C is doing fabulous, let's put you on 500 milligrams instead, and let's see how your sugars are doing, then great, maybe you can wean off of it. If your sugars are still not doing well, it's definitely not safe to just quit, just because your sugars will skyrocket.
Bella Nava Marquez, hello from San Jose, California. Is Naproxen safe to take every month for menstrual cramps? I don't foresee an issue with that. Do you?
No, that's totally fine. You're not taking it for months at a time. You're taking it for the time where you have your menstrual period, and then you get off of it.
The old Flexeril, Brian Lloyd states Flexeril, the old muscle relaxer, pretty much. Am I right?
Yeah, that's a muscle relaxer. It's a prescription. It can make you drowsy. And if you needed to, you can take Tylenol with that. That's fine.
Okay, cyclobenzaprine. What can we mention about that?
That's also Flexeril. It's the same thing as Flexeril.
Now, with people who take muscle relaxers, very common. I've been on it one time in the past. sometimes just get really tired. And sometimes I believe even on the medication or side effects, driving, you got to be careful. It can make you sleepy. Any comments you can say to these people, maybe that are first taking it, to be aware, because this can really throw you off?
Definitely, especially because most of them drove to the pharmacy and they'll pop in a pill and then, go drive home. Definitely, if it's the first time they're taking it, we counsel them. We let them know it can cause drowsiness. Some people can take all of these medications and not feel a thing and be fine and be normal and function. And other people, they'll take an ibuprofen and be down. So yeah, definitely with something like Flexeril, if it's your first time taking it, you just want to be cautious before you go out and about.
Someone's taking Ativan. Ativan is basically just kind of winds you down a little bit.
Right, that's lorazepam. It's for anxiety.
Okay, so a lot of people, it's a big drug. I kind of hear this all the time. Many people have mentioned this to me. Is this an addictive drug, Ativan, or is it something?
Definitely. So it's considered a controlled substance here in the United States. So it is anything that's a controlled substance has a chance for being addictive or abusive. So yes, it's a very popular drug. It helps a lot of people out, but it can be very addictive.
A lot of people come in and you see that maybe are osteoporosis, have taken calcium, have taken bone calcium, their bones. They had to check to see how their numbers are. If they're low in calcium, if they're osteopenia, osteoporotic. Vitamin D is so important. I believe that we don't get enough vitamin D because of the fact that most people don't spend enough time in the sun. The sun is obviously a sunshine vitamin when it comes to vitamin D. Plus, in certain areas of the world or countries they live in, or even in winter time, they don't get enough sun. And most of the foods that we get are primarily added to it. They're added to our milks, and they're added to certain foods. But vitamin D is, like sardines and certain fish, you get a lot of vitamin D. But just as and plus, we look at the bad foods, the sugars, and all the crappy stuff we eat, which is sometimes depleting our nutrients and vitamins out of our system. Vitamin D, I guess the base is around 600 IUs or 600 to 700, depending upon what they say. I take 5,000 every day. And my vitamin D level is only in the 40s. I mean, it's 30s, 40s. It sometimes just doesn't get up there.
Right.
The body just doesn't assimilate it. So sometimes let's jump up to 10,000.
Right.
So, but vitamin D is so important. I think, what's interesting, Doc, is that when we look at the statistics and the studies of COVID, over 80 to 85% of all the people that had COVID, or those that even unfortunately passed away, all had low vitamin D levels. All had low vitamin D.
It's a very common deficiency. I work here in Florida, and a lot of people are on prescription strength vitamin D. Yeah.
And the difference between, now basically the vitamin D, there's two types of vitamin D. Okay. Obviously hold on a second. I'm getting confused here. The D3 versus D2.
Correct.
So the D3 is the one you'd probably recommend that most people would take.
Right.
Correct?
Right, because it absorbs easier.
Gotcha. Very important. Let's see here. If you just tuned in, go ahead and give us a few little words in the chat where you are tuning in from. If you are outside of the country, we'd like to see where you're from. Would like to take paracetamol. Now, paracetamol is basically your Tylenol.
Yeah, it's very similar. Yes.
With coffee, increases its effectiveness for migraine pain. You may want to comment on that.
So that's basically like Excedrin. So Excedrin has caffeine with Tylenol or caffeine with ibuprofen. And studies have shown that it does increase effectiveness for migraines. Yes. Interesting.
Well, the last few questions, let's go ahead and take, because we're going to wind down. We've been here and here. We have about 550 people in the chat room right now. We really appreciate all of you chatters out there. Let us know where you're tuning in from if you're out of the country, particularly if you're on the other side of the world. We are here in the United States. We always love to see where people are listening to. We'll take your last few questions before we make way and let her take care of her family. She's got a little baby sleeping. We'll make sure that baby stays asleep. We want to say hello to you from Canada. You have a sleeping problem here. I see. We were prescribed melatonin. Is it safe to take for a long period of time? Basically, let me say melatonin is secreted from the anteropituitary part of the gland, the pineal gland. And basically that melatonin is secretes when it becomes dark. So I'll tell people that when you go to bed, make sure you kind of get rid of those lights. The darker your room, the better. And the old blue light is not good for the brain because that will inhibit sometimes melatonin. I would always say start on the lighter side of melatonin, about 3 milligrams, give or take. And kind of if they have to work up, what's your opinion on the melatonin part?
I think melatonin's great because it's not as addicting as some other drugs, and it doesn't cause the morning drowsiness that some other medications do. I actually say start around either the 5 or the 10,
Okay.
just because you want it so it works. So it goes up to 12 milligrams. Usually 5 or 10 is okay for adults to take. 3 milligrams, I'm not sure if it's actually going to have an effect. Even babies can take 1 milligram. So I usually say start between 5 and 10, depending on their sleep issues.
Correct. I guess it's different for each person.
Right.
Last couple of questions. If you'd like to get through to us, we are going to wind down here. Dr. Mendelsohn taking her precious time to be with us, helping the world out there, talking about the old medications. And let me tell you, without medications, we'd be in big trouble. Medication saves lives. It helps people get out of misery. It helps them sleep. It helps them relax. So there is a need for it, as like anything else in life. We want to say hello to you in, where did you go? Boy, you're moving too quick for me. Here you go. In Alaska. Hello, Alaska. We want to say hello. We want to thank you so much for being here as well. You're a great help. Yes, she is a great help. So the last few questions we will go ahead and take, and I am searching for them. They are coming through here. You could ask your last few questions. Any last words you'd like to say to our audience? Anything, just some words of wisdom, anything maybe if they're having conditions to try to be more proactive, speak to their doctor, be more aware of interactions of drugs are taken, or maybe, be aware of certain foods that maybe you shouldn't be taking with certain drugs. There's a lot of little things that go on. I know we don't have much time, but just something simple. Maybe you want to go ahead and give your last few words to them.
Yeah. Just in general, if you ever have any questions, to speak to your local pharmacist is such an easy thing to do. We're always available. You can either walk in or call in, and we're glad to help you. I know a lot of these things, it's very overwhelming, and health and medicine and all of that, it's very overwhelming. So it's good to get organized, yourself to get organized. Don't ever forget to omit over-the-counter medications when your doctor asks, what are you taking? You always let them know what herbal supplements you're taking, any vitamins, anything like ibuprofen, Tylenol. Just let them know everything and try to keep as organized as you can.
Last question here. This is something that comes up quite often today. We got the old Concerta and coffee. Is that a nay, or maybe you want to comment on that? So
Concerta is used for ADD or ADHD. So it is a stimulant already. If you have a cup of coffee and you're personally fine and you feel like you can sleep at night, great, drink the cup of coffee. If you find that you're having trouble sleeping or it's making you jittery or anything like that, I would switch to decaf or try to omit it.
And while we're on coffee, the decaffeination versus the caffeination, is there any significant problem with those that drink too much caffeine and take certain types of medications? Because I believe certain medications they may be taking, particularly like cold medications, may already have stimulants in there, which can obviously make them shaky, can increase their heart rate, their sympathetic nervous system, their blood pressure, and maybe comment that if they notice that things are getting worse, to stop doing it, because a lot of people aren't really aware. Something they may not be able to have a blood pressure cuff available. They may not really understand what's going on, and obviously taking too much caffeine, because caffeine is a drug, all right, in the sense of anxiety.
Definitely.
Anxiety is a huge condition throughout the entire world because of our stresses. We have our old sympathetic, we have our high cortisol levels, and it really can wind us up, and it can lead to panic attacks and lead to a whole vicious cycle of problems. Just like when people come in to see you, they say, I feel wounded up, I'm getting difficulty breathing. We know anxiety can mimic a heart attack, even though they're not really having one. So anything, just going back to the coffee, the stimulant, and the anxiety. Last words.
Right. So if you're on a stimulant, you definitely want to limit your caffeine intake. Also, Sudafed. So when you buy Sudafed from the pharmacy, which is used for congestion, it has pseudoephedrine in it. That's also a stimulant.
For sinuses.
Correct, for your sinuses. So that can make you very jittery. So you want to be careful with the caffeine intake with that one as well.
Wow, that was beautiful. Well, we got about 42 minutes into the program. It went so fast. And I'm sure that the audience, as well as the many hundreds of thousands of people who are going to see this video, they're going to want you back. All right. So you're going to read the comments as well. And I ask everyone out there who's tuning in right now, or you're tuning in as it's on the channel right now, leave your comments. Leave it for Dr. Mendelsohn. Let her know, how wonderful she did. I'm sure she's going to go back and read the comments. I'd love to see hundreds and hundreds, if not thousands of comments, because this is about touching people's lives, touching their hearts. And that's what we're here for. We're here to help your lives and to see you stay healthy, live a long life, and to have a happy life to live with you, your loved ones, and your family. Well, thank you again so much. All right, I'm going to go ahead and we're going to end the broadcast. And again, this will be put on the channel. And all I can say is thank you. God bless. We'll see a good prayer, lots of good health to our audience out there. Anyone listening, we appreciate you being in the chat room. We have almost 600 people here. Thank you again. And I hope you learned a lot. And leave your questions below in the comments, because you will get many people responding. Dr. Mendelsohn will do her best periodically to go in there and make a few comments, but it's all good. And tell me how bad you want to get her back on here again for a nicer, bigger, better program. God bless you. And we'll be with you real soon once again. And if you haven't subscribed, please do so. Push the button. You'll get notifications. So we want to keep you and your family healthy. Bye-bye now.